Bengaluru, Arogya City Bengaluru, a pioneering collective effort that began in 2022 to help address non-communicable diseases, NCDs, in the city, celebrated a significant milestone today with the successful completion of its initial 2-year cycle. 22 dedicated Pledgemakers achieved remarkable success, reaching more than 1 million citizens across Bengaluru with their health interventions over the last 2 years. In addition, education materials were distributed to more than 1 million people. The accomplishments were celebrated at a summit hosted at Mount Carmel College, also a Pledgemaker, with the Hon'ble Minister for Health Family Welfare, Government of Karnataka, Shri Dinesh Gundu Rao, attending as the chief guest. Her Highness Pramoda Devi Wadiyar graced the occasion as the guest of honor, presenting awards to Pledgemakers, and Dr. Sudarshan Ballal, Chairman of Manipal Hospitals, delivered an inspiring keynote address. And innovations. But behind its thriving skyline lies a silent crisis, a growing epidemic of non-communicable diseases impacting millions. Over 75% of Bengaluru's metro adults are diabetic or pre-diabetic, while 1 in 4 deaths is due to cardiovascular diseases. These numbers reflect lives disrupted, families in crisis, and futures at risk. Our founding principle has been that NCDs are not inevitable, they are preventable. In response to this urgent need, Arogya World, Rotary and BPAC launched the Arogya City movement. Built on collaboration, it unites corporations, NGOs, schools and governments to improve health outcomes in Bengaluru. In just 2 years, Arogya City has reached over 2.1 million people directly and created nearly 98 lakh online impressions. From screening to lakh 75,000 individuals for NCDs to engaging 20,000 youth in health awareness programs, the impact is undeniable. We thank Satwa for doing a pro bono process assurance of the Arogya City program. Let's hear from Bengaluru's health champions.
आरोग्य सिटी मूवमेंट में ये हिस्सा लिया क्योंकि मैं इनके बारे में जानना चाहती थी। मैं शपथ लेती हूँ कि शुगर का इस्तेमाल कम करूँगी, चिप्स और चॉकलेट को मना करूँगी। हम घर में योगा क्लासेस टीवी से देखकर प्रैक्टिस कर रहे हैं। हमारे पेरेंट्स हमको चिप्स और चॉकलेट की वजह हमको फ्रूट कोकोनट वाटर ला रहे हैं। थैंक यू।
ನೀವು ಇದು ಮಾಡಿದ್ರಿಂದ ಅವ್ರಿಗೊಂದು ಗೊತ್ತಾಗಿದೆ, ಎಲ್ಲ ಒಂದು ಊಟ ಮಾಡುವಾಗ ಇದು ಹೇಳಿದ ಕಮ್ಮಿ ಅನ್ನೋದು ಅವ್ರ ತಲೆಯಲ್ಲಿ ಇರುತ್ತೆ ಯೋಚನೆ. ಈಗಾಗಲೇ ಟ್ರೈನಿಂಗ್ ಎಲ್ಲ ಕೊಟ್ಟಿದ್ದಾರೆ, ಬೇರೆ ಬೇರೆ ಟ್ರೈನಿಂಗ್, ಫುಡ್ ಟ್ರೈನಿಂಗ್ ಕೊಡ್ತಾರೆ, ಮತ್ತು ವ್ಯಾಪಾರಿಗಳ ಟ್ರೈನಿಂಗ್ ಕೊಡ್ತಾರೆ. ಅದೇ ಆರೋಗ್ಯ ವರ್ಲ್ಡಿಂದ ಮೈಥಾಲಿ ಟ್ರೈನಿಂಗ್ ಏನು ಕೊಟ್ಟಿದ್ದಾರೆ ಅದು ತುಂಬ ಜನಕ್ಕೆ ಸಹಾಯ ಆಗಿದೆ. ನನಗೆ ಅನಿಸುತ್ತೆ ಮುಂದೆ ಒಂದು ದಿವಸ ಇದು ಎಲ್ಲೋ ಒಂದು ಜಾಗ ನಮ್ಗೆ ಕಾಣುತ್ತೆ ಇದು ರಿಸಲ್ಟ್.
The initiative taken by Arogya City is important as it perfectly aligns with our mission and vision at clinic to promote health by building a strong, affordable and sustainable foundation for preventive and promotive primary care.
From corporates promoting employee wellness to community groups leading fitness drives, our Pledgemakers are at the heart of this transformation. The journey doesn't stop here. Our vision is to make Bengaluru a role model for healthier living across India, reaching 5 lakh lives by 2025. Every pledge counts. Whether you're a corporate leader, an NGO, or a citizen, your commitment can drive this movement forward.
We have launched this project Asare, wherein any health emergencies anywhere in Bangalore, if an ambulance is required, an ambulance will reach the place. We have described a number. This number I will circulate with all of you. Anybody in Bangalore can call up this number to seek assistance of an ambulance or a doctor on call. This is a service given free of cost by Rotary throughout Bangalore.
Our scope in the Arogya City project is only on diabetes, but we have a wide spectrum of projects in Rotary which cover from maternal and child health, disease prevention and treatment. We have literacy and education, water and sanitation, taking care of economies, peace building, and environment now, which is the 7th area of focus. So it's large scope for this screening is very small, but it's a big thing for us because typically we spend, sir, it is not a mean fee, in our two districts combined. In 1 year we spent almost about 150 crores of rupees.
Was doing it, AI Health joined. When MLAC was doing it, Arogya Birla joined. So many of those have come together and we've made sure that we've made much progress. We thought we will reach 500,000 people, but we reached more than 1 million in the last 2 years. So all of us have put in effort, and mostly the Pledgemakers. They are the heroes. Because it is voluntary, as Nalini said, and people have the heart to do it. So we will look at the video of all the Pledgemakers that they've done their work and celebrate their success. Thank you.
Arogya City, the people who are part of this Arogya City Bengaluru, all the Pledgemakers and all the supporters for having come together and created this platform where various people can contribute and work together and create a sizable impact on the way people are living and the health conditions and to try and see that how we can alleviate health problems that people are facing. So I think as a minister, I would like to congratulate them for having taken up this initiative and being able to implement in such a successful manner. I think that is the key. A lot of ideas are always thought about, but ultimately when it gets implemented, the impact on the ground becomes, not as we foresee. But here, I was just going through when I was walking down that passage, and I was looking at all the things that they've done. And I think it is wonderful that they've been able to reach thousands and thousands, in fact lakhs of people in Bengaluru, and being able to make a difference. And this is really a work, I think, which is highly commendable. Like what was said earlier, there are two aspects to health. One is when you fall ill and then you need to get treated, you go to either the government hospital, the private hospital, nursing homes, clinics, and get yourself checked and start your treatment. That's when we go to Dr. Sudarshan Ballal, to Manipal, because we have fallen ill and we need to get treated. And that is something which is very important, no doubt about it. Every country, every state, every city needs good medical facilities, good doctors, good paramedics, and good ambulance services. All that is of great essential. It's an essential requirement. And there are many people in this field. There is the huge private sector, there is the government sector, and there are individual doctors with their own private clinics and small nursing homes, all operating. So there's a huge supply for the demand that people who are falling sick are creating. So that is one thing where we can say that to a large extent, people do get services. There's no lack of service availability. But I think on the other side, when we talk about preventive health, and when we talk about how we can stop people from getting sick, or to be able to control the spread of disease, or to be able to improve people's lifestyle, there is no incentive for a private person to come and work. Because it's not that there is any money to be made or profits to be made. It is a service-oriented field. And in this space, the biggest responsibility is for the government. I think government should look at the preventive part in a much more bigger manner than what we are looking at today, and give our greater focus on public health, to see that how we can improve public health. And that has got various components. Revati Ashok was saying, it's a question of lifestyle, clean water, clean air, better, planned cities, all the things contribute to health of an individual. And the kind of food we eat, the quality of food, all those things play a big role. So government's role is very, very crucial here. And along with government, I think, to actually make it, really successful on the ground, it requires an enlightened citizenry. and enlightened, people who are coming together to doing work for the good of society, and NGOs and institutions like Rotary and BPAC and so many of the names that we see over here who are contributing. So this is a very, very crucial area for us. And I think the Arogya City concept is focusing on this aspect.
First time I'm hearing about health and wellness of the city. So I congratulate the spirit behind this movement, Nalini, Salina, all the participants actively involved in this. I also congratulate the service-oriented organizations, corporates, volunteers, and collectively who all have contributed to this movement for the commendable work which has made the city. I think I just heard earlier that they started with a very small number and then now they've reached 5 million, if I'm correct, 5 million people, and then the help has reached that, and then I congratulate Archana. I think you are the one who mentioned that about. Yeah, so congratulate you on that. For me, health